Here's the conclusion of this video in advance. If you're a patient considering surgical treatment for any condition, don't become enamored by so-called cutting-edge medical devices or techniques. Don't let technology take you down a path that leads to an unhappy place. And don't treat your body as an experiment. In my career as a spine surgeon, I have seen a lot of things come and go, and I want to share 4 difficult lessons I have learned with you. Newer is not necessarily better. More technology is not necessarily safer. The more high tech the procedure, the less predictable the outcome. And finally, innovation in medicine is driven mostly by profit. One of my great heroes, Carl Sagan, famously said, extraordinary claims require extraordinary evidence. You, as a patient, should never forget that. One of the most fun things about my job as a spine surgeon is that I have a lot of very interesting discussions with my patients about spinal disorders. For example, they ask me questions about something they read online, something they saw on social media, some fancy new minimally invasive surgical procedure, or a new pain management procedure, or robotic image guided spine surgery, endoscopic spine surgery, even awake spine surgery. Basically, what they are trying to figure out is if any of these innovations is better than the standard surgical options that we have available today. What I really like about these conversations is that it helps my patients make medical decisions that are right for them. That is the most important thing. But one of the worrying trends that I have noticed over the past decade is that patients often come to me believing that surgical success depends to a significant degree on the technological sophistication of the type of implants, hardware, software, technique that is being used during the surgery. Through careful marketing, patients are being led to believe by surgeons, pain management doctors, and the billion-dollar corporations that produce medical devices that a certain type of medical device or minimally invasive surgical technique is the best option for them. The first thing you need to know as a patient is that the billion-dollar corporations that manufacture surgical devices understandably make a lot of claims about the alleged superiority of their products, just as a company that makes cars or washing machines claims that it is better than its competitors. As far as spine surgery is concerned, in my opinion, in the year 2025, the hardware used in spinal fusion, rods, screws, cages, plates, tends to be functionally equivalent across major manufacturers. That may not have been the case 20 years ago, but at this point, most spinal hardware is pretty similar because the optimal design features are well known due to a process of trial and error. You can call it natural selection. Despite this, spine surgeons and pain management doctors frequently make outsized claims about the alleged superiority of the surgical devices and techniques that they use. The fact of the matter is that these claims, involving technical jargon and supported by selective data, are often more marketing than medicine. The supposed advantage of implant A versus implant B are usually marginal at best. One of the problems is that doctors themselves are not immune to the influence of these marketing efforts. In a healthcare system where financial relationships between doctors and medical device companies are legal and often very lucrative, the recommendations of doctors can be influenced by financial interest. Speaking engagements, consulting fees, and royalty arrangements shape the preference and decisions for a lot of doctors. This raises important ethical questions, especially when patients are completely unaware of the financial incentives that may be guiding such choices. I hope one day patients will understand that the name or the type of the surgical implant is rarely what determines the success of the surgery. Much more critical is the judgment and the technical skill of the surgeon. The most high tech surgical hardware or minimally invasive surgical technique cannot compensate for careless execution, insufficient planning, or a lack of attention to detail. A skilled, careful, thoughtful, confident, experienced surgeon is much safer using the standard, well accepted surgical techniques with a long track record compared to another surgeon who is using new technology as a marketing tool to attract more patients. What matters most in spine surgery, and in fact all of medicine, is the character and competence of the surgeon. Unfortunately, as a patient, it is very difficult to know this in advance. I wish all of you the best of luck.